it's very problematic to me when I see people explaining fertilization and creation of an embryo or baby like she did. Today we are reacting to 1950s sex education, Molly Grows Up. I am so excited to watch it with you and see what we can learn, or rather see maybe what our parents didn't learn in their sex ed classes. I have had every problem with my audio, my video, my internet, the lighting, everything. I need to stick to clinical medicine.
The whole church was lighted with candles. First wedding I've ever been to. And golly, you should have seen the bride. She had the most beautiful dress I've ever seen. It was all white satin. Come on, we'll be late for school. Coming, Peggy.
Okay, well, we're just going to jump right into it by saying any sex ed that starts out with discussion of the wedding is probably going nowhere fast, because we can't assume that nobody's having sex before they get married. Even if that's your personal choice, a vast majority of the population do not have that personal choice, and framing sex ed within that relationship is very problematic, both from a standpoint of consent and understanding to also shame and guilt. So, I mean, it's the 1950s, what did we expect, right? But I hope that someday when I create a sex ed curriculum, it won't start out with that.
I've known Molly and her family ever since she first came to school, and I think you might like to know her too. Molly lives at home with her father, her mother, and her older sister, Jeannie. Molly and Jeannie get along, well, about as most sisters do.
Molly, what do you think you're doing?
Nothing, Jeannie. I just happened to come in and...
Honestly, Molly.
I just wanted to try them.
Well, why don't you ask Mom for some things of your own? You're old enough now.
Okay, we're 3 minutes in and we finally might be getting to something informational. I'm not going to include that whole 3 minutes, but basically all we've seen so far is Molly being a kid who probably is like 11 or 12, and now she's gone into her sister's room and made her sister angry because she stole her lipstick and tried on her clothes, typical sister things. And now her sister has grabbed a pad out of the drawer, so maybe we're getting to something educational here, but mind you, this is 14 minutes and 20 seconds and probably the only sex ed that these girls were getting in 1953, and we've spent a fourth of the video already on Molly as a person, which, great, but...
When do you think I'll start having periods, too?
Oh, I don't know. Pretty soon, I suppose. I was 13 when I started.
Peggy's already started hers, and I'm 6 months older than she is.
Well, so what? Some start earlier and some later. We're all different.
I love that they're normalizing that different ages of going through puberty is totally normal. It's not all based on just your age. We call this menarche, and age of menarche depends most highly on when your mother went through menarche. This can vary, though, greatly by body weight, BMI, activity, things like that. And also it has changed over the years to become slightly earlier than the average was probably in 1953. I do want to commend them for normalizing that everybody starts at different times, and that can be totally normal.
Mom, I started my first period.
Come on, sit down. Tell me about it. When did it start?
Well, it was this afternoon when I was changing into my gym clothes, and I noticed a bit of blood on my panties, and then I remembered when we talked about
Menstruation.
menstruation and stuff, and, well, then I went to see Miss Jensen.
So seems like Molly's family has wonderful open communication about menstrual cycles, which is awesome. Unfortunately, I think that most sex ed, if we don't have a comprehensive curriculum that starts at a young age and follows a child from, basically defining their body parts all the way up through actually learning about intercourse and how babies are made and how to prevent STIs and things like that, that we also have to include what is a menstrual cycle in some of the sex ed.
Menstruation is perfectly normal. It happens every month. Of course, right at first you probably won't be very regular. Most girls don't settle down for a year or so. Even then, some girls go more than a month between periods and others less. That's normal, too. And eventually your body will set up its own regular time. Please sit up, Molly.
Oh, Mom, I'm comfortable.
But Mom, I'm comfortable. That's like every kid her age ever when asked to do something that they don't want to do. And I know this because I was once a kid, but also I have some of them in my house. They really hit the nail on the head with this one. She's discussing immaturity of the HPO axis, which is basically the idea that after the first menarche, it often takes several years for cycles to really regulate. If it takes a while for your cycles to become regular and predictable after the first menarche, that's okay, even 3 or more years in some people. But if you're ever having really, really long, really, really heavy cycles or really, really painful cycles, that's never normal, and you should at least chat with us so we can kind of talk about it and see what we can figure out.
If you sit and stand straight, that'll give the organs inside your body room to function better. And that'll make you feel better.
I'll get it. That's probably Peggy.
I don't know that that's actually true, but probably won't hurt anything.
Sure, just a minute, I'll ask. Mom, can I go swimming with Peggy tomorrow after school?
I don't think I would, Molly.
But I'd be home by 5:30.
No, it's not a good idea the first 2 or 3 days of your period. You might get chilled and catch cold.
Oh, that's right. Peggy, of course I can't go swimming. You know I've got the curse. That's right. It isn't a good idea the first couple of days. Okay, I'll see you tomorrow. Bye.
I love how she went from like a little bit frustrated with her mom to like, yes, Peggy, why would you bother me by asking me that? You know I started my period today and I can't swim. Obviously, everybody watching this probably knows that that's not accurate. It's totally fine to swim at any point in your cycle. If you are swimming, you probably will not catch a cold or chills just because you're on your period. And when I say probably, I mean definitely. That won't happen.
What was all the talk about in here? Is this a private conference?
No, I don't think so. Do you, Molly?
No, I guess not. You tell her, Mom.
Well, Jim, Molly's growing up. She's having her first menstrual period.
What? Already? Oh, but Alice, I thought... Well, I mean, after all, she's only...
Daddy, don't be so silly. I'm not a baby anymore.
I know, dear, but, no, honey, I guess you aren't.
I actually think that this is probably pretty progressive in the 1950s to depict the family talking about this together and to have Molly open to discussing it with her father. I love that. I mean, this was even in an era when, right, wasn't I Love Lucy around that time? I'll have to look it up, but it may have been earlier. But we couldn't even depict people sleeping in the same bed if they were married. So I love that they're trying to normalize that it's okay to have periods and it's okay to talk about it with your family and it's okay to talk about it with your friends. So I think that was probably progressive in 1953.
Growing up is fun, but some of the things Molly used to do seem a little silly now. Sometimes she gets all mixed up just thinking about it. She's changing from a child into an adult, and it's a little confusing at times.
It's a little confusing at times when, you know, you're just playing with dolls and then you have a period and all of a sudden you hate dolls after that and you just want to be grown up. I don't know that it happens that fast. I think probably Molly still likes all of the things she liked last week before she had her first period, but I know they're trying to get the point across that things change and growing and changing is different. But I think really in this we should be focusing on how your body is growing and changing and everything is different and that you may have different feelings, but not to make people feel like once they have their first period, now they have to be a grown-up, because that's certainly not the case.
This is a diagram of the uterus or womb, and these are the fallopian tubes leading to it. And these the ovaries which produce the egg cells. Now these egg cells are far too small for us to see, but once each month an egg cell will leave one of the ovaries, go into the opening of the tube nearest to it, and then it's on its way to the uterus.
I actually really like that depiction. I think that's very age appropriate for like a 10 to 12-year-old and maybe even younger. I mean, my kids definitely know a little bit of that already.
And the uterus has been preparing a growing place for this egg, a soft lining of blood vessels and tissues.
We're 10 minutes into this 14-minute video and we haven't even mentioned sex yet, and this is supposed to be sex ed.
If the egg unites with a male cell or sperm as it's on its way down the tube, it is fertilized. And then when it reaches the uterus, it settles down in this soft lining and begins to grow into a baby. If the egg cell is not fertilized, it disappears.
It's very problematic to me when I see people explaining fertilization and creation of an embryo or baby like she did, which is when the fallopian tube has an egg in it and there happens to be a sperm cell there, they meet and make a baby. What this does in the minds of kids who can't conceptualize sex yet because they haven't been told anything about like actual sexual intercourse is make them think that they might just one day wake up pregnant and not know that there's an active component to baby making. This is extremely important for sex ed. Kids don't ever need to be under the impression that they might just happen to become pregnant. I can't tell you how many times I've had people tell me that growing up, their parents told them God puts a baby there, or mommy and daddy pray for a baby and it goes there, or that it happens like they explained it here, and the kid spends years of their life praying to God not to put a baby because they don't want a baby. So I think that's really, really important, and hopefully they'll hit on it in the next 2 minutes and make this whole rant completely meaningless. At least maybe that will make sense to someone out there about why it's important to have these discussions with your kids.
Since the lining is no longer needed, it too dissolves away. And it flows out of the body through an opening in the hymen.
When does menstruation start?
Average age seems to be about 13.
No, I mean what day of the week will it start? My mother starts on Tuesday. Will mine too?
Oh, it might, but it probably won't, because each girl's body sets up her own time and rhythm. And the time between periods may vary anywhere from 23 to 32 days. And the flow lasts from 2 to 7 days, also depending on the girl's own rhythm.
That's actually a good question, and I get it in a little bit different of a way that people ask in my clinic, which is sometimes people come to me and they think that their period should be starting on the same day of the month or the same day of the week every time, and that's not really how it works. Number of days between periods, we count from the first day of bleeding to the last day before you have bleeding again. That's your cycle length. And that number can vary anywhere from about 28 to 35 days. So that means that the number of days that you don't have bleeding between your last day of bleeding and the first day of bleeding again can really highly vary depending on both your cycle length and the number of days of bleeding that you have, which anywhere from like 5 to 7 is normal there. So you see that it can be very confusing when people are tracking their cycles. And this is why I really encourage my patients to track their cycles with an app. That's why it's not always on the same day of the month or the same day of the week, because that number may not always line up with the calendar. Your body doesn't know where you are at in a calendar. It just knows what your normal is.
Many of you girls haven't started to menstruate yet, but when you do, you will want to use a sanitary napkin to absorb the flow. It's a soft, absorbent pad, and it's made to fit over the opening of the vagina and to follow the curve of the body. The tab ends are attached to a narrow elastic belt which you can wear around your hips or waist.
I feel like this is pretty good. I mean, if we ignore the fact that it's supposed to be sex ed and we just talk about the fact that it's menstrual ed, then these are great answers.
Now, some girls prefer to use tampons. A tampon is a cylinder of absorbent cotton inside a cardboard applicator. It is inserted into the vagina by means of the applicator. The cotton absorbs the flow, and when it is full, you remove it and discard it. You should be more careful than ever about personal cleanliness and daintiness. Change your underwear more often, and be sure and use a deodorant. And pay more attention to your hair and your nails, and plan to wear your prettiest dress. In other words, be your most attractive self.
A little problematic to put so much pressure on them, you know. I mean, if it makes you feel better to get up and get ready and do your makeup and look nice when you're on your cycle, great, do that. I personally feel more alive when I get up and do my hair and makeup, unlike today when I just stuck it in a ponytail because I couldn't be bothered to do that. Some people don't want to do all of that, and you shouldn't be under pressure to do something that you don't feel like doing, especially when you're a teenager learning about your period.
What about dancing? Can you when you're menstruating?
Yes, you can, with moderation. In fact, you can do most of the things you usually do. You can bathe or shower as long as you use warm water. And you can wash your hair if you're sure to dry it quickly. And you can swim if you wait until after 2 or 3 days after the beginning of your period. And you can go to dances and picnics. Not a very good idea to skate or ride horseback or play fast games like volleyball and basketball or do strenuous dancing like square dancing.
I think we talked about this a little when I did the Disney video, which had kind of these same precautions. And I was like, why are they saying this? Well, Some of you astutely in the comments were like, well, duh, their period products weren't as good and this is to avoid leaks. So maybe that makes sense. But here we're still saying this like, don't use cold water, you might get sick. Make sure you dry your hair quickly, you might get sick. And this is all silly, right? Like you can't get sick more easily just because you're on your period. That is absolutely not true. But I do understand why with the period products back then, they would say, you know, be careful about dancing around and stuff. I wish they would have told them why, because it kind of makes it sound scary. Like, oh my gosh, don't do Foursquare. You might end up having something terrible happen. We're not going to talk about what it is, when it's actually just like your Sani pad might leak a little. This is how we contribute unexpectedly or not on purposely. I can't come up with words today. This is how we contribute not on purpose to making kids scared of having periods, because we're not being completely open about why these things are off limits.
And you'll be sure and tell your mother or me if everything doesn't seem to be just right. Now, I'd like each of you to take one of these booklets about menstruation, and when you finish reading it, if you have any questions, be sure and come and see me. Menstruation is as normal and natural as eating or breathing or sleeping.
Always when I make these videos, people are like, oh, you're critiquing it and it was a different time. Yes, I know that, Susan. I know it was a different time. I do think it's important to point out how far we've come and also the mistakes that we've made in the past so that we can continue to improve. And I will see you next time.